The rain had been falling for 6 hours, a relentless, percussive drumming against the panoramic windows of the surgical ICU. It was 2:17 a.m. Inside, under the unwavering hum of fluorescent lights, Elias Carter pushed a mop across the polished linoleum. The water left a dark, gleaming trail that smelled of antiseptic and lemon, a scent he'd come to associate with the quietest hours of human desperation. He moved with an unhurried, practiced economy, his body a study in making itself small, forgettable. His gray and blue janitor's uniform was loose, designed to obscure, to blend into the institutional beige of the walls. He was 52 years old, though the 5 years he'd spent in these corridors had carved lines around his eyes that suggested a longer, harder journey. Gray threaded the dark hair at his temples, a quiet surrender. He kept his posture slightly stooped, a conscious unlearning of the straight-backed authority he once commanded. But there were things he couldn't hide, his hands, for one. Even gripping the worn metal shaft of the mop, they were remarkable. Long-fingered, elegant, with impeccably clean short nails. They were the hands of a man who understood precision. A faded, silvery scar, thin as a spider's thread, ran from his left knuckle to his wrist, a ghost of a forgotten battle with a bone flap. On his other wrist, he wore a Patek Philippe Calatrava, a watch from another life, its face turned inward, a secret against his skin. He worked his way down the central corridor, the rhythmic swish-slap of the mop, a form of meditation. He didn't look at the patients in their glass-walled rooms, not directly. It was a rule he'd made for himself. But he saw. He always saw. He saw the subtle sag on one side of a sleeping face, the almost imperceptible tremor in a hand resting on a white sheet, the way a patient's breathing hitched for a fraction of a second before a monitor alarmed. His eyes, trained over a career spanning 15 years to find anomalies on a screen no bigger than a postcard, now scanned the periphery, absorbing data by instinct. He registered the drip rates, the ventilator pressures, the wavering lines of ECGs reflected in the polished floor. Tonight, his gaze kept drifting to room 4. The patient was a young woman, maybe 20. A college student, he'd overheard the nurses say. Maya Dean. She'd had a grade 1 aneurysm clipped yesterday afternoon. A routine procedure, as routine as drilling a hole in someone's skull and navigating the labyrinth of the brain could ever be. The surgery had been a success. But as Eli passed her room for the 3rd time that night, he saw a flicker on her arterial line monitor. A transient dip and recovery in her blood pressure, so fast the central monitoring station likely registered it as an artifact, a ghost in the machine. But it wasn't a ghost. He'd seen it before. Twice. Once in a patient in Philadelphia, and once in a case study he had published in the New England Journal of Medicine 17 years ago. He felt a cold knot tighten in his stomach, a feeling he hadn't allowed himself to have in 5 years. He paused, his mop still, and watched the reflection of her monitor in the glass. Everything looked normal now. Too normal. The charge nurse, a harried woman named Brenda, strode past him without a glance. Carter, when you're done here, the on-call room needs a full wipe down. One of the residents spilled coffee everywhere. Yes, ma'am, he said, his voice quiet, neutral. The voice of a man who wiped up other people's messes. He resumed his mopping, the motion a physical act of pushing the thought away. It wasn't his concern. His concerns were floors, trash cans, and the small, bright world contained in a 9-year-old boy's bedroom 3 miles away. His promise was to that boy, not to the ghosts on these monitors. He finished the corridor and pushed his cart into a small, cluttered supply closet. The air was thick with the smell of bleach and cardboard. He closed the door, plunging the tiny room into near darkness, save for the green glow of the cart's charging light. He pulled out his phone, the screen illuminating his face, deepening the shadows in the hollows of his cheeks. He pressed the single favorite on his contact list, Leo. The phone rang twice before a small, sleepy voice answered. "Dad?" A warmth spread through Eli's chest, chasing away the chill from the ICU. "Hey, buddy, I didn't wake you, did I?" "No, I was dreaming." The voice was hesitant. Eli's own voice softened, losing its neutral edge, becoming something else entirely, the only voice that mattered anymore. "A good dream, I hope." There was a pause, the sound of a small boy thinking hard. It was the one about the boat. Eli's heart clenched. The boat dream. The one where Leo was on a little boat, and the shore kept getting further and further away, and he couldn't find his dad. "I'm right here, buddy," Eli said, his voice a low, firm anchor. "Even when you can't see me, I'm right here. I'm just at work." "I know," Leo said, his voice a little stronger now. "Mrs. Gable made me hot chocolate before bed, the kind with the little marshmallows." "Was it good?" "Yeah. She said you'd be home before the sun comes up to make pancakes." It was their ritual. After a night shift, he always made pancakes, no matter how tired he was. A promise solidified in batter and maple syrup. "I promise," Eli said. "And I keep my promises. You know that." "I know. That's what daddies do," Leo said, the simple statement a profound absolution. "Dad?" "Yeah, kiddo?" "The project for school, the one about what our parents do. Can I say you're a scientist?" Eli froze, the phone cold against his ear. A scientist. He looked around the dark closet, at the stacked boxes of sterile wipes and bedpans. "Why a scientist?" he asked, his voice carefully level. "Because you're always cleaning things, to get rid of germs. That's science, right? Making things safe." A lump formed in Eli's throat. Out of the mouths of babes. He had spent his entire adult life making things safe, in the most complex and dangerous landscape imaginable. Now he did it with a mop. To his son, the core principle was the same. "Yeah, buddy," he said, his voice thick. "You can say I'm a scientist." "Okay. Love you, Dad." "I love you more, Leo. Go back to sleep." He hung up and stood in the darkness for a long moment, the phone's screen gone dark. He was a scientist who made things safe. He was a father who kept his promises. The image of the flickering line on Maya Dean's monitor returned, unbidden. A life was becoming unsafe, just a few yards away. He had built this quiet, anonymous life as a fortress to protect his son and to protect himself from the man he used to be. But what good was a fortress if you watched someone perish just outside the walls, knowing you had the key to the gate? The institutional blindness of a large hospital was a phenomenon he knew intimately. He'd fought against it as a chief of department, and now he was hidden by it. A janitor was part of the scenery, a non-person who existed to maintain the illusion of sterile perfection. To the doctors and nurses rushing past, he was just Carter, a pair of hands that emptied trash bins and refilled paper towel dispensers. They didn't know those same hands had performed over 300 successful craniotomies for complex intracranial tumors and aneurysms. They didn't know those hands had once been insured by Lloyd's of London for $10 million. They didn't know that the man they ignored had written the definitive textbook on cerebrovascular surgery, a copy of which sat on a shelf in the office of the very man who would soon be in charge of this girl's life. The crisis deepened just after 3 a.m. A code blue was not called. It was something more insidious. A series of quiet, urgent alarms from room 4. Eli was in the on-call room, wiping down a table, when he heard the rapid footfalls. He stepped into the hall. A young resident, his face pale and slick with sweat under the harsh lighting, was talking rapidly to Nurse Brenda. Her GCS has dropped to 11. She's not responding to verbal commands, just to pain. Left-sided weakness is more pronounced. "Did you call Dr. Thorne?" Brenda asked, her voice tight with professionalism. "He's on his way. I think it's a re-bleed, or maybe a clot. We need to get her to CT now. Stroke protocol." Eli stood by his cart, motionless. It wasn't a re-bleed. A re-bleed would have come with a thunderclap headache, a sudden and catastrophic drop in consciousness. It wasn't a clot, not with that labile blood pressure he'd seen earlier. The symptoms the resident was describing, the intermittent nature of the decline, it was classic delayed cerebral ischemia, secondary to a vasospasm. The artery near the site of the clipping was beginning to constrict, starving a part of her brain of blood. The standard stroke protocol for a clot would be useless, might even be harmful. They were chasing the wrong phantom. He felt the old instinct surge, a tide he'd spent 5 years building dams against. The world slowed down. The frantic energy of the nurses, the resident's panicked voice, the incessant beeping of the machines. It all faded into a low hum. In its place, a cold, clear silence bloomed in his mind. He saw the girl's brain, not as a mystery in a skull, but as a map he knew by heart. He saw the circle of Willis, the delicate arteries branching like a winter tree. He saw the tiny metal clip, a permanent sentinel, and the vessel next to it, spasming in irritation. He knew what needed to be done. Triple H therapy wasn't the first line anymore, not since the nimodipine trials. You needed to increase her perfusion pressure carefully, but first you needed the vasodilator. You needed a transcranial Doppler to confirm the increased flow velocity. You had a window, maybe 4 hours, before the ischemia became irreversible infarction. Before Maya Dean, the 20-year-old college student, was left with permanent, devastating brain damage. He watched the resident get on the phone, his voice high with a panicky authority that Eli recognized as fear. He was ordering the CT, mobilizing the stroke team, wasting precious minutes. Every tick of the clock was a neuron dying. He thought of Leo's simple faith. You make things safe. He thought of Clara. He thought of the last conversation he'd had with her, her voice weak, her hand in his. "You have to keep going, Elias," she had whispered. "You have to keep using your gift. Don't let this break you." He had let it break him. The day she died, a fine, uncontrollable tremor had started in his right hand. It was psychosomatic, the neurologists had told him, a physical manifestation of grief and guilt. A surgeon with a tremor is like a pilot with vertigo. His career had ended that day. He'd walked away from the hospital, from the name Dr. Elias Vance, from the accolades and the pressure, and he had never looked back. He'd moved here, to this city where no one knew him, taken his mother's maiden name, and found the most anonymous job he could think of, in the one place he knew better than any other. A hospital. It was a penance. A way to be close to the world he'd lost, without having to be responsible for it. But responsibility was a stubborn ghost. It had found him here, in the middle of the night, next to a bucket of dirty water. He looked at his hands. The tremor was still there, a faint, barely visible vibration in his right thumb if he held it out. Not enough to be noticed by a casual observer, but he felt it. A constant reminder of his failure. But he didn't need his hands to save this girl. He just needed his voice. He took a slow, deep breath, the air tasting of bleach and fear. He pushed his cart forward, the squeak of the wheels unnaturally loud in the tense hallway. He was no longer Eli Carter, janitor. He was a man walking toward a fire everyone else was misdiagnosing as smoke. He was choosing to act. He knew the risk, humiliation, disbelief, being fired. But the greater risk was silence. The risk was spending the rest of his life knowing he stood by and did nothing while a life unraveled because of institutional pride and a young doctor's fear. He stopped his cart near room 4, just as a tall, imposing figure in surgical scrubs swept onto the unit. Dr. Aris Thorne, chief of surgery, a man Eli knew by reputation only. A good surgeon, but arrogant, a man who believed fervently in hierarchy. The confrontation was inevitable. If you believe that people deserve to be seen for who they truly are, not just what their job title says, subscribe now and share this story. Now, back to what happens next. Dr. Thorne's presence immediately changed the unit's atmosphere. The quiet panic solidified into a rigid, nervous attention. He was a man in his late 50s, with a mane of silver hair and a sharp, hawkish face that was currently set in a scowl of intense displeasure. He didn't walk. He commanded the space he moved through. "Report!" he snapped at the young resident, Dr. Miller, who visibly flinched. "Dr. Thorne. Patient is Maya Dean, 20-year-old female, post-op day 1 from a right MCA aneurysm clipping. She was stable until approximately 2:45. GCS dropped from 15 to 11. New onset, left-sided hemiparesis and expressive aphasia. My assessment is an acute thromboembolic event or a small re-bleed. I've initiated the stroke protocol and ordered an emergent head CT." Thorne nodded curtly, his eyes already scanning the monitors inside Maya's room. "Vitals. BP is fluctuating, 140/90, but she's had dips down to 110 systolic. Heart rate is stable in the 80s. Eli stood by his cart, a dozen feet away. He could feel the stares of the other nurses on his back. What is the janitor doing? He focused on a nurse he recognized, Anya Sharma. She was younger, in her late 20s, but had a reputation for being sharp and observant, less cowed by the hospital's rigid caste system. She had once thanked him for noticing a loose railing on a stairwell and reporting it, a small act of seeing him as more than part of the furniture. He caught her eye for a fraction of a second. Thorne was already moving toward the room. "Let's get her to the scanner. Time is brain." This was the moment. The window was closing. Eli took a step forward. "Nurse Sharma," he said, his voice low but clear, pitched to carry just to her. Anya turned, her expression a mixture of surprise and curiosity. "Eli, what is it?" "Ask him to check for vasospasm," Eli said, his voice barely a whisper. "The blood pressure lability, the intermittent symptoms. It's not a clot." Before Anya could process this, Thorne, who had the sharp hearing of a predator, spun around. His eyes narrowed, first at Anya, then landing on Eli with the full force of his authority. "What did you say?" Thorne's voice was dangerously quiet. Eli stood his ground, his posture straightening instinctively, the old authority settling on his shoulders like a forgotten coat. He met the chief of surgery's gaze. "I said, you should consider vasospasm." A stunned silence fell over the hallway. The other nurses stared, mouths agape. Dr. Miller looked utterly bewildered. Thorne's face, however, went from irritation to a cold, contained fury. "Who is this?" he demanded of the unit, not deigning to address Eli directly. Brenda, the charge nurse, hurried forward. "That's just Eli Carter, one of the janitors, doctor. I'm so sorry. I don't know what he's doing here. He was just cleaning." Thorne's gaze was dismissive, contemptuous. He took a step toward Eli, his sheer physical presence a form of intimidation. "You're the janitor. And you have a medical opinion?" He said the word janitor as if it were a contagion. "This is a sterile, restricted area during a medical emergency. You are to return to your duties, now, or I will have security escort you from this hospital permanently." Eli didn't flinch. He thought of Leo. He thought of Clara's last words. "Don't let this break you." His voice was calm, measured, devoid of any defensiveness. It was the voice he had used for 15 years to soothe worried families and command tense operating rooms. "With respect, Dr. Thorne, I disagree with the initial diagnosis. I'm not asking you to trust me. I'm asking you to consider the possibility before you send her for a CT scan you don't need." He took another small step forward, gesturing with his head toward the monitor inside the room. "Look at her arterial line history. The past 3 hours. There are transient, sharp dips in her mean arterial pressure. They last for less than a minute. Those aren't artifacts. That's the vessel spasming and then relaxing. A clot doesn't do that. A rebleed doesn't do that. You can dismiss me based on my current job title, or you can run a transcranial Doppler and find out whether I'm right. You have maybe 3 hours before her deficits become permanent." Thorne's face was a mask of incredulity and rage. The sheer audacity of a janitor, a man in a stained uniform, lecturing him, the chief of goddamn surgery, was an insult of the highest order. "I have been a surgeon for 30 years, Thorne hissed, his voice low and venomous. "I have forgotten more about the human brain than you will ever know. How dare you?" He pointed a finger at Eli's chest. "You are finished. Get out." As Eli instinctively raised a hand, not to argue, but to point again at the monitor's history log on the screen, Thorne's anger boiled over. He slapped Eli's hand away. The right hand, the one with the tremor, the one that had held the fate of hundreds of lives within its grasp. The physical contact was shocking, a sharp cracking sound in the tense quiet. "Security!" Thorne roared. "Get this man out of my ICU!" But just as 2 burly security guards started down the hall, a new alarm blared from room 4, a high, piercing shriek. Maya was seizing. "She's in status!" Miller yelled, rushing into the room. The seizure was violent, a grand malconvulsion that shook the entire bed. Her vitals on the monitor went haywire. Her oxygen saturation plummeted. The controlled chaos of the code team descended. Thorne, his face ashen, shoved his anger aside and took charge, barking orders for lorazepam, for an airway cart. In the swirl of activity, Anya Sharma, the young nurse, looked from the convulsing girl to Eli, who stood perfectly still, his face a mask of grim certainty. His words echoed in her mind. Intermittent symptoms. Vasospasm. This seizure, this catastrophic event, wasn't the sign of a clot. It was the brain's desperate, final protest against profound ischemia. She made a decision. As Thorne was ordering a second dose of anticonvulsants, Anya stepped up to him. "Doctor," she said, her voice shaking but firm. "He was right about the pressure lability. I saw it myself on the chart review earlier. What if it is a spasm? The seizure could be from the ischemia. The stroke protocol won't stop this." Thorne, his own confidence shaken by the sudden, violent turn of events, looked from Anya to the seizing patient, and then his gaze fell on Eli, who was being held by the security guards near the nurses' station. He saw not a janitor, but a man of unnerving calm, his eyes fixed on the patient with an intensity that was anything but custodial. He saw the absolute certainty in the man's posture. Desperation warred with pride on Thorne's face. The girl was crashing. His current plan was failing. "What did you say it was?" Thorne yelled down the hall at Eli, the question an admission of defeat. Eli met his gaze. The guard still had his arms. "Cerebral vasospasm. Delayed ischemia post-clipping. It's constricting the middle cerebral artery. The seizure is a result of cortical irritation from severe lack of blood flow." "And the treatment?" Thorne's voice was clipped. He was testing him. "You need to break the spasm and increase perfusion," Eli said, his voice cutting through the noise. Start an IV nimodipine drip immediately. Get a transcranial Doppler in here to confirm elevated flow velocities in the right MCA. And you need to induce hypertension. Bring her systolic up to 180, maybe 200, carefully. Use a phenylephrine drip. You need to force blood through that narrowed vessel. The level of detail, the specificity of the drug choices, the precise diagnostic steps. This was not a guess. This was not something gleaned from a TV show. This was deep, ingrained, expert knowledge. Dr. Miller and the other residents stared, dumbfounded. Thorne was a man of ego, but he was not a fool. And above all, he was a doctor who did not want to lose a patient. He made a split-second decision. "Forget the CT," he yelled. "Get me pharmacy now. I want nimodipine, stat. Get a Doppler tech up here. And someone get me a goddamn phenylephrine drip." He turned to Anya. "You heard him. Let's move." He looked back down the hall at Eli, a look of profound world-altering confusion on his face. He nodded curtly to the guards. "Let him go." Eli rubbed his arm where the guard had gripped it. He didn't move. He just watched as the team, now galvanized with a new, correct purpose, swarmed around Maya Dean. He watched as the IV bags were swapped, as the Doppler machine was wheeled in, as the numbers on the monitor began, slowly, agonizingly, to respond. The seizure subsided. Her oxygen levels began to creep back up. The frantic energy began to coalesce into focused, effective care. He had been right. The girl would live. The immediate crisis passed. The sun had not yet risen, but a pale, watery light was beginning to filter through the rain-streaked windows, signaling the approach of dawn. Inside the ICU, a fragile quiet had descended. Maya Dean was stable. The transcranial Doppler had confirmed it. Severely elevated flow velocities in her right MCA, classic signs of a major vasospasm. The nimodipine and induced hypertension were working. Her neurological status was already improving. She was stirring, following simple commands. She was out of the woods. Dr. Thorne stood outside her room, looking at the monitors, his shoulders slumped. He ran a hand through his hair, the gesture of a man whose world had been shaken to its foundations. He had been wrong, catastrophically wrong. And the man who had been right, the man who had saved this girl's life and his career, was the janitor he had humiliated and assaulted. He turned and walked slowly down the corridor to where Eli was quietly gathering his things, preparing to leave as his shift ended. The security guards were gone. The other nurses were busy with their patients, but they cast furtive, awestruck glances in his direction. Eli was just a janitor again, putting a new liner in a trash can. Thorne stopped a few feet away. For a long moment, he said nothing. He simply looked at the man in the gray uniform. He looked at the intelligent, weary eyes, the set of his jaw, and the surgeon's hands that were now tying a knot in a plastic bag. "I owe you an apology," Thorne said, his voice low, stripped of its earlier arrogance. "And this patient owes you her life." Eli finished tying the bag and placed it on his cart. He didn't look at Thorne. "The patient owes her life to the team that treated her. A team that was heading in the wrong direction until you intervened," Thorne countered. He took a step closer. The hallway was empty now, just the two of them. "I was wrong, I was arrogant, and I am profoundly sorry." He finally looked at the hand he had slapped. "I never should have done that." Eli finally turned to face him. He gave a small, tired nod of acknowledgement. For him, the apology was secondary. The outcome was all that mattered. But Thorne wasn't finished. His mind was racing, trying to reconcile the man in front of him with the knowledge he had displayed. That wasn't a lucky guess. The specificity, nimodipine, the Doppler velocities, inducing hypertension, That's not something you pick up from watching television, so I'm going to ask you one more time. He paused, his gaze intense. Who the hell are you? Eli looked down at his watch, the hidden Patek. The shift was over. Leo would be waking up soon. He had pancakes to make. I'm the janitor, he said, his voice flat. My shift is over. He began to push his cart away. No, Thorne said, stepping in his path. That's not good enough. Not anymore. He pulled out his phone. I'm the chief of surgery at this hospital. I can find out who you are in about 5 minutes. I can pull your employment records, your social security number. But I'm asking you to tell me yourself. Give me that courtesy. Eli stopped. He looked at the man in front of him. He saw the genuine confusion, the humbled curiosity. The secret he had guarded so fiercely for 5 years was already unraveling. Hiding was a choice he had made out of grief, but perhaps it was a choice that had run its course. My name, Eli said, his voice quiet but firm, is Elias Vance. I used to be the chief of neurosurgery at Johns Hopkins. Thorne's eyes widened. The name hit him like a physical blow. Vance, Dr. Elias Vance, the Vance Protocol for Cavernous Sinus Approaches, the Vance-McConnell classification for AVMs. The man was a legend, a ghost. He had published over 200 peer-reviewed papers. He had disappeared from the medical world 5 years ago. Rumors had swirled, a breakdown, a family tragedy, a mysterious illness. No one knew the truth, and he was here, mopping floors. Vance. Thorne whispered the name, a look of dawning horror and awe on his face. You wrote the book, the one on my shelf. I did, Elias said. He felt a strange sense of detachment, as if he were talking about someone else. What happened? Why are you here? Elias's gaze became distant. He thought of Clara, of the smell of her shampoo, of the helplessness of watching her fade. I had my reasons for leaving, he said, his voice laced with a finality that brooked no further questions. Reasons that are my own. He met Thorne's eyes again. I came here for anonymity. I would appreciate it if you would respect that. He pushed his cart past the stunned chief of surgery and walked toward the locker room, the squeak of the wheels echoing in the silent hall. He had revealed himself. The walls of his fortress had been breached, not by an enemy, but by his own buried instinct to heal. He didn't know what would come next, but as he walked away, he felt not fear, but a flicker of something he hadn't felt in a very long time, the faintest stirring of purpose. The next few days were a strange purgatory. Thorne, true to his word, kept the secret. But the hospital was a village, and whispers traveled faster than gurneys. The story of the janitor who had saved Maya Dean was told and retold, morphing with each telling. Some said he was a disgraced doctor, others a fallen genius. To most, he was a momentary hero, a curiosity. To Eli, it was a profound disruption of the quiet life he had so carefully constructed. Nurses would stop and stare at him in the halls. Residents would fall silent when he entered a room. He was no longer invisible, and he hated it. He kept his head down, did his job, and counted the hours until he could go home to Leo. Thorne, however, was a man transformed. The incident had shaken his faith in the system he commanded, and in himself. He was haunted by the image of Eli's calm certainty in the face of his own blustering ignorance. He found himself questioning his senior residents more, listening to his nurses more intently, and he couldn't get Elias Vance out of his head. 4 days after the incident, Thorne was wrestling with another baffling case. A 62-year-old man, post-craniotomy for a benign meningioma, was failing to wake up from anesthesia. All his scans were clear. No bleed, no stroke, no swelling. His vitals were rock solid, Every test had come back negative. The anesthesiology team was stumped. The neurology consult had been useless. The man was simply gone. After another fruitless meeting, Thorne found himself walking, almost unconsciously, toward the hospital's sub-basement, a labyrinth of steam pipes and storage rooms. He found Eli in a vast, echoing chamber, methodically polishing the floor with a large, roaring industrial buffer. The machine's noise was deafening, a wall of sound that sealed Eli off from the world. Thorne waited until Eli switched the machine off. In the sudden silence, the dripping of a leaky pipe sounded like a drumbeat. "Dr. Vance," Thorne began. "It's Eli," he corrected, not looking up, his focus on a scuff mark on the floor. "And I'm working." "I know. I'm sorry to interrupt," Thorne said, his tone deferential. "I have a case, and I'm out of ideas." Eli sighed and finally straightened up, wiping his hands on a rag. He looked tired. "That's not my world anymore, Dr. Thorne." "Please," Thorne said. "Just listen. No one needs to know. 62-year-old male, meningioma resection 3 days ago. Clean surgery, perfect scans. But he won't wake up. GCS of 3. He's breathing on his own, but there's no response. Nothing." Eli was silent for a moment. The diagnostic part of his brain, the part he had tried to starve for 5 years, flickered to life against his will. It was a puzzle. And he had always loved puzzles. He leaned against the handle of the floor buffer. He didn't ask about the scans or the labs. He knew Thorne would have covered all the basics. He asked about the things others might not. "Was he on any psychiatric medications before the surgery?" Eli asked his first question. Thorne was taken aback. Yes. A low-dose SSRI for anxiety. Standard protocol, we tapered him off it a week before the procedure." Eli nodded slowly. "Second question. Did you use methylene blue during the resection to mark the tumor margins?" Thorne's eyes widened slightly. Methylene blue was a common surgical dye. "Yes, a very small amount. It's completely routine." Eli's gaze was distant, seeing connections Thorne had missed. "One last question," he said. "Check your anesthesiologist's records. What did they use to manage his blood pressure during the surgery?" Thorne's mind raced. He was a surgeon, not an anesthesiologist, but he was in the room. He remembered the brief dip in pressure, the calm announcement from behind the curtain. "They used, I think it was a vasopressor. Phenylephrine, maybe." Eli nodded, the puzzle pieces clicking into place. "It wasn't phenylephrine," he said with certainty. "They used norepinephrine. Check the record." He looked at Thorne, his eyes clear and direct. "Your patient isn't in a coma. He has serotonin syndrome." Serotonin syndrome, a rare, potentially fatal condition caused by an excess of serotonergic activity in the central nervous system. Thorne felt a jolt, as if from a live wire. It made a terrifying kind of sense. The SSRI, even tapered, would have left his system primed. Methylene blue, which most clinicians forget, is a potent monoamine oxidase inhibitor, MAOI, would have prevented the breakdown of serotonin. And norepinephrine, another agent that boosts serotonin, would have been the final, catastrophic ingredient. The triad was the perfect storm. "My God," Thorne breathed, "we never even considered it. The symptoms, they don't present like this, so comatose." "They do when it's this severe," Eli said quietly. "The non-convulsive status is rare, but it happens. You've been treating him for a neurological problem. You should have been treating him for a toxicological one." He paused. "You need to start him on cyproheptadine and cooling measures. Now. His temperature is probably climbing, even if it's masked." Thorne stared at him, speechless. In the space of 90 seconds, with 3 questions, The janitor in the basement had just diagnosed a case that had stumped his entire staff of specialists for 3 days. It wasn't luck. It was genius. How? Thorne managed to ask. How did you know to even ask about the dye? I read a case report, Eli said, his voice distant, about a similar reaction in a cardiac patient. Years ago. It just stuck. He turned back to his buffer. Now, if you'll excuse me, I have a floor to finish. Thorne didn't move. He knew, in that moment, that letting this man continue to push a mop was not just a waste. It was a sin. It was a danger to every patient in the hospital. He had to do something. Stories like this remind us that expertise can hide anywhere, and dismissing someone based on their position might mean missing the person who could save everything. If that resonates, hit like and comment where you're watching from. Because what Eli does next changes everything. 2 days later, Thorne found Elias in the hospital's small, sun-drenched chapel during his lunch break. It was the one place Eli had found where no one bothered him. He was sitting in a back pew, not praying, just looking at the stained glass window depicting a shepherd. Thorne slid into the pew next to him, leaving a respectful distance. He woke up, Thorne said quietly. The man with the meningioma woke up this morning, confused, weak, but he's back. You were right. About everything. The norepinephrine, the methylene blue, it was all in the record. No one put it together. Eli gave a slight nod, his eyes still on the window. I'm glad to hear it. I pulled your file, Thorne continued, his voice soft. Your real file, from the Hopkins archives. I read about your wife, Clara. Glioblastoma. I'm so sorry. Eli's jaw tightened, but he remained silent. I also read the report about your hand, Thorne said gently. The psychosomatic tremor, after she passed. He paused. Is it still there? Eli slowly held up his right hand. In the quiet light of the chapel, the tremor was visible, a fine, high-frequency vibration that made the light shimmer on his skin. It never left, he said. It's my ghost. So you can't operate, Thorne stated, not as a question. No, Eli confirmed. I can't operate. But your mind, Thorne said, leaning forward, his voice filled with a passionate urgency. Your mind is a gift, Elias. It's a resource this hospital, these patients, desperately need. What you did for Maya Dean, what you did for Mr. Albright, that wasn't a fluke. It was the culmination of 20 years of experience and a level of diagnostic acumen I have never seen. To let that go to waste polishing floors, it's a form of malpractice, for all of us. Eli finally turned to look at him. What do you want from me, Eris? The use of his first name was a small bridge. I want to offer you a position, Thorne said, his words carefully chosen. Not as a surgeon. I respect what you've lost, what you've decided, but as something new. I've already cleared it with the board. We're creating a new role. Director of Diagnostic Review. You'd be a consultant, a ghost in the machine, if you want. You'd review our most complex cases. You'd sit in on grand rounds. You'd be a teacher, a mentor to the residents who are learning to see the forest for the trees. No surgical responsibility, no direct patient care, unless you want it. Just your mind, your eyes. We need your eyes, Elias. Eli looked away, back at the stained glass. The offer was a lifeline to a part of himself he thought was dead. It was purpose. It was respect. It was the world he had mastered. Everything he had been before the fall. But the fall had changed him. The fall had given him Leo. I can't, he said, the words tasting like ash. My life is different now. I have a son. My hours here. They're predictable. I'm home every morning. I'm there to pick him up from school. I make him dinner. I can't go back to 80-hour weeks, to being on call, to a life that belongs to the hospital." "I'm not asking you to," Thorne said quickly. "You set the terms. You tell me the hours you can work. 20 hours a week, 30, 9 to 3 every day, no weekends, no nights, no call. Whatever you need for your son, you get. Your son is your priority. I understand that. But for those hours you are here, give us your gift. Don't let your grief bury it forever." The sincerity in Thorne's voice was undeniable. The offer was more than fair. It was an act of profound respect. It was a path back, not to the man he was, but to a new version of himself. A man who could be both Dr. Vance and Eli Carter. He felt torn in two. For 5 years, he had built a life around a simple, inviolable principle. Leo first. This quiet, anonymous life was safe. It was predictable. It was a shield against the chaos that had shattered his world. The thought of stepping back into that high-pressure environment, even on his own terms, was terrifying. What if he failed? What if the demands grew? What if it took him away from his son, not physically, but mentally, emotionally? The weight of that world was immense. He wasn't sure he could bear it again. "I have to think about it," he said, his voice barely a whisper. "Take all the time you need," Thorne said, standing up. "The offer is open. It will remain open." He placed a hand briefly on Eli's shoulder. "What you have, Elias, it's meant to be shared. Hiding isn't the same as healing." Thorne left the chapel, leaving Eli alone with the silent shepherd and the ghost in his hand. He looked at his trembling fingers. For 5 years, he had seen the tremor as a punishment, a mark of his failure to save Clara. But what if it wasn't just an ending? What if it was also a beginning? A signpost pointing him toward a different way of using his gift, a way that didn't require the impossible stillness of a surgeon's hand. He thought of Leo's question, "Can I say you're a scientist?" He was. He always had been. The question was, could he be a scientist again, and still be the father his son needed? That evening, the conflict churned inside him as he made dinner. Macaroni and cheese from a box, just the way Leo liked it. He watched his son at the small kitchen table, carefully drawing a complex diagram of a rocket ship with a rainbow of markers. Leo was a quiet, observant boy, with Clara's deep brown eyes and her thoughtful frown of concentration. "How was school?" Eli asked, stirring the cheese powder into the pasta. "It was okay," Leo said, not looking up from his drawing. "We presented our projects, about what our parents do." Eli's stomach tightened. "Oh yeah? What did you say about me?" "I said you were a scientist at the hospital," Leo said, matter-of-factly. "And you make sure everything is super clean so people don't get sicker. And that you make the best pancakes." Eli smiled, a genuine smile that reached his eyes. "Sounds about right." He served the macaroni, and they ate in comfortable silence for a few minutes. Then, Leo put his fork down and looked at his dad, his expression serious. "Dad," he asked, "did something happen at work? You look different." Eli was taken aback. "Different how?" "I don't know," Leo said, scrunching his nose. "Less gray. Your eyes are louder." "Your eyes are louder." The simple, poetic observation of a child cut through all of Eli's adult complexity. He hadn't realized how much he'd been holding in, how much of his own light he'd been dimming. The events of the past week had forced that light out, and his son had noticed. He took a deep breath. He wouldn't tell Leo everything, not the details of Maya Dean or the confrontation with Thorne. But he would tell him the truth that mattered. "A man at work, a doctor, asked me to do a new job," Eli began slowly. "It's a job where I would help the other doctors with very difficult problems. using my head, like solving puzzles. Leo's eyes lit up. Like a detective? Sort of, Eli chuckled, but it would mean I'd be at the hospital a little more. Not at night, like now, but during the day. I would still pick you up from school, I would still make you dinner, and we would always have pancakes, I promise. He watched his son's face carefully. But I'm worried it might be too much, that I'd be too tired or too busy in my head. Leo considered this with the gravity only a 9-year-old can muster. He looked at his drawing of the rocket, then back at his dad. Is it like what you used to do? He asked quietly. Before, the job that made Mom proud. The question was a soft blow to the chest. Eli had told Leo that his father used to be a different kind of doctor, a brain doctor, and that his mother had been very proud of his work. They didn't talk about it often. Yes, Eli said, his voice thick. It's a lot like that. Leo looked at him, his gaze clear and unwavering. Mom would want you to do it, he said simply. And, you don't look like a ghost anymore, Dad. I like it. He picked up his fork. Can we still have pancakes on Saturdays? Saturdays, Sundays, and any other day you want, Eli said, a massive weight lifting from his shoulders. The decision was made. It wasn't about choosing between his past and his present. It wasn't about choosing between being a doctor and being a father. It was about integration. It was about showing his son what it meant to be whole. The next morning, he found Dr. Thorne in his office. He didn't knock. He just walked in. Thorne looked up from a pile of paperwork, a hopeful, questioning look on his face. 9 to 3, Eli said. Monday to Friday. No call, no weekends. I get every school holiday off. And my title is not director. It's consultant. I report to you, and only to you. A slow, wide smile spread across Thorne's face. He stood up and extended his hand. Welcome back to the land of the living, Dr. Vance. Eli looked at Thorne's outstretched hand, then at his own. He reached out and took it. His hand trembled slightly, but his grip was firm. It's Eli, he said. The transformation was quiet, but profound. The janitor's uniform was replaced by simple slacks, a button-down shirt, and a plain white lab coat with no name embroidered on it. He was given a small Spartan office in the administrative wing, with a window that overlooked the hospital's healing garden. He spent his first week just reading files, hundreds of them, absorbing the hospital's recent history, its successes, its failures, its patterns. He began attending grand rounds, sitting in the back, a silent observer. At first, the residents and attending physicians were wary of him. They knew the story of the janitor, but they didn't know the man. He rarely spoke. But when he did, his questions were like scalpels, cutting through layers of assumption and conventional wisdom to expose the core of the issue. You've ruled out an ischemic cause for the patient's delirium, he might say, his voice calm and even. But have you considered the metabolic? What was her ammonia level on admission? Or, to a resident presenting a complex tumor case, the imaging suggests a high-grade glioma, but the patient's age and the location in the cerebellum are atypical. Has anyone on the pathology team considered a medulloblastoma with late-onset presentation? The staining would be different. Slowly, the culture began to shift. The residents, initially intimidated, started seeking him out. They learned that he wasn't there to judge them, but to teach them to think differently. He never gave them the answer directly. Instead, he taught them how to ask the right questions. His office, once empty, began to have a steady stream of visitors. Young doctors, hesitant at first, would stand in his doorway. Dr. Vance, Eli, do you have a minute? We have a patient in the neuro ICU. He became Thorne's secret weapon. Before any high-risk neurosurgery, Thorne would review the case with him. Eli would look at the scans, his eyes tracing the blood vessels, seeing the potential pitfalls, the hidden dangers. "The approach from the left is standard," he'd say, pointing at an MRI. "But look at this bridging vein here. It's unusually large. If you tear that, you'll be in a world of trouble. Consider a posterior approach. It's longer, but safer." He was a ghost in the machine, just as Thorne had offered. A whisper of guidance, a voice of experience. The tremor in his hand remained, a constant companion. He'd feel it when he held a coffee cup or when he gestured toward a screen. But it no longer felt like a mark of failure. It was just a part of him now, a reminder of the fragility of the things he worked so hard to protect. About a month after he started his new role, he was walking through the main lobby when he saw a familiar face. It was Maya Dean, the young woman whose life he had saved. She was dressed in street clothes, a backpack slung over her shoulder, walking between two people who were clearly her parents. She had a slight limp, the only visible remnant of her ordeal, but she was smiling, animated, alive. Her parents were looking at a hospital map, confused. Maya's gaze drifted, scanning the lobby, and then her eyes locked with Eli's. Recognition dawned. Her parents didn't notice, but she stopped walking. She excused herself and walked directly toward him. "Hi," she said, her voice a little shy. "I don't know if you remember me. My name is Maya." "I remember you, Maya," Eli said, a warm smile touching his lips. "It's good to see you on your feet." "They told me what happened," she said, her eyes welling with tears. "About you. That you were the janitor. And you spoke up when no one else knew what was wrong." She shook her head, a look of wonder on her face. "My neurologist said I would have had a massive stroke, that I probably wouldn't be able to walk or talk again, if it weren't for you." She took a shaky breath. I wanted to say thank you. You gave me my life back." Her parents, noticing she had wandered off, came over, looking concerned. "Maya, honey, who is this?" her mother asked, eyeing Eli's simple lab coat with a hint of suspicion. Maya turned to them, her face beaming. "This is him," she said. "This is the man who saved me." Eli simply nodded to her parents, a lump in his throat. "I'm glad you're recovering well, Maya," he said. He gave her a small, encouraging smile and walked away, leaving the family staring after him, the parents in confusion, the daughter in profound gratitude. He didn't need their thanks, but hearing it, seeing her whole and healthy, was a form of healing he hadn't known he needed. It was the closing of a circle that had begun in grief and ended in grace. The impact of Eli's presence rippled through the hospital. Thorne, emboldened by Eli's success, formalized his influence. He created the Vance Protocol, a mandatory checklist for all post-op neurological patients that forced nurses and residents to actively screen for the subtle signs of vasospasm, delirium, and other non-obvious complications. It was a protocol born directly from Eli's insights. Within 6 months, the hospital's post-surgical neurological complication rate dropped by a staggering 12%. Lives were being saved not by a single dramatic intervention, but by a systemic change in how the institution saw its patients. A change sparked by one man who had been invisible. If this story is proving that courage isn't about not being afraid, it's about acting anyway, hit subscribe and share it with someone who needs to hear this. Because Eli didn't stay invisible. They chose to be seen, and that choice is about to matter more than anyone expected. Eli's influence extended beyond checklists. He began holding weekly teaching sessions for the residents, informal affairs in a small conference room with a whiteboard and bad coffee. He wouldn't lecture. He would present a case, often a real one from their own wards, and simply ask, "What are we not seeing?" He taught them to listen to nurses. He taught them to question their own assumptions. He taught them to see the patient as a story, not just a collection of symptoms. The Eli sessions, as they became known, were soon the most popular educational hour at the hospital. He found a balance. At 2:45 p.m. every day, he would pack up his bag, leave the world of medicine behind, and drive to Leo's school. He was just another dad in the pickup line. They would talk about their days, do homework at the kitchen table, and cook dinner together. The worlds remained separate, but they were no longer in conflict. They were two halves of a whole life. He was Dr. Vance, the brilliant consultant, and he was Eli Carter, Leo's dad. He was no longer hiding one from the other. 1 year passed. It was a bright Saturday morning in October. The air was crisp, and the leaves on the maple tree outside their kitchen window were a riot of red and gold. The smell of buttermilk pancakes and sizzling bacon filled the small house. Eli stood at the stove, a spatula in his hand, flipping a perfectly golden brown pancake. His hand, he noticed, was perfectly still. The tremor hadn't vanished. It still appeared when he was tired or stressed. But in these moments of simple, domestic joy, it slept. Leo, now 10 years old and a half-foot taller, sat at the table, a sketchbook open in front of him. He was no longer the small, anxious boy who had the dream about the boat. He was confident, happy, secure in the knowledge that his father was present, that his world was stable. "Check this out, Dad," Leo said, turning the sketchbook around. Eli brought a plate stacked high with pancakes to the table and looked at the drawing. It was a surprisingly detailed rendering of a superhero. The hero wore a white coat instead of a cape, though a small red cape fluttered from his shoulders as an afterthought. He had dark graying hair and was holding a glowing orb that looked suspiciously like a human brain. In the background, shadowy figures in hospital beds were turning from gray to full color. Below the drawing, in careful block letters, Leo had written, "Dr. Dad." "That's you," Leo said, his mouth full of pancake. "Saving people." Eli stared at the drawing, a profound warmth spreading through him. He saw it all in that childish drawing, the past, the present, the future he was building. He saw the ghost of Dr. Vance, the quiet penance of Eli Carter, and the emergence of this new man, this Dr. Dad. Thorne had recently offered him a promotion, a more formal title, a bigger office, more money. He had politely declined. He had what he needed. He had his son, he had his purpose, and he had his peace. He was a consultant, a teacher, a father. He was a man who had walked through the valley of the shadow and found his way back into the light, not by forgetting his ghosts, but by learning to walk alongside them. He looked at Leo, who was now happily drenching his pancakes in an obscene amount of maple syrup. He thought of Clara, and for the first time, the memory brought not a sharp stab of pain, but a gentle, wistful warmth. She would have loved this. She would have loved the man he had become, the father he was. She would have loved their son. He sat down opposite Leo, the morning sun streaming through the window, illuminating the dust motes dancing in the air like tiny, benevolent spirits. The fortress he had built to hide himself away had become a home. The silence he had cultivated had been filled with laughter and the clatter of forks on plates. He was no longer defined by the job he had lost, or the woman he couldn't save. He was defined by the son he was raising, and the lives he was still able to touch. He was not Dr. Elias Vance, the fallen neurosurgeon, nor was he Eli Carter, the invisible janitor. He was both, and he was neither. He was a man who had finally learned to hold his grief in one hand and his purpose in the other, and found, at long last, that his hands were steady enough for both. If this story reminded you that hiding isn't the same as healing, and that being truly seen is worth the risk, subscribe, share, and comment below. Because somewhere right now, someone is hiding gifts the world needs. Maybe this story will remind them to step forward.